Good morning, good afternoon to all, and a very warm welcome on behalf of the IAPB events team to today's webinar, 2030 Insight for Our Children. I'm now delighted to hand over to Jude, who's going to formally welcome you to today's webinar.
Thank you, Russell. It's lovely to be here today. We'd like to welcome and thank you everybody who's online for joining us at whatever time of day it is in your end of the world. My name, as Russell said, is Jude Stern. I'm the Head of Knowledge Management here at IAPB and delighted to be connecting with everybody again. I'm coming to you today from Gadigal land of the Eora Nation in Sydney, Australia, and I'd like to acknowledge the traditional owners of the land and acknowledge any Aboriginal and Torres Strait Islander people that are here and present with us today. This is a very exciting week for child eye health. How did we know we were going to have a webinar in a week where we also got a global commitment at the Commonwealth Heads of Government meeting in Rwanda this week? It's a landmark commitment on child eye health specifically. If you haven't already seen, 54 nations have committed to a multi-pronged approach for access to screenings and affordable vision treatments, especially for children. This has been at least 4 years in the making, and many of the IAPB members and IAPB staff have been working hard towards this goal, and so it's a very exciting commitment to have and really underpins the reason why we need to have these webinars and continue working together across the sector and outside the sector to make sure that we're providing child eye health services, informing child eye health policy, integrating within broader health services and activating demand and markets that are required to provide child eye health. So today I'm so happy to have joining me experts from the field who have all made very significant contributions in child eye health and help us understand the need, the importance, the challenges, and the way forward to make our children see better and have accessible, affordable, and quality eye care when and wherever they need it. Just before I go ahead and introduce the speakers, I'd like to encourage you to introduce yourselves. Please say hi, tell us who you are, where you're logging in from, and what organisation or what area of work you're in. We'd love to know who's online today, and more importantly, connect with each other. You can always say hi to people you have not seen for a while or people who you'd like to meet. So please do that in the chat as we go today. So the wonderful speakers that are joining us are, we have three speakers up front, Priya Mararia, Milka Mulfouri, and Andreas Muller. Priya is probably well known to most of you. She's the Head of Global Program Design at Peak Vision, and she's also the co-chair of the IAPB School Eye Health Work Group, and been very involved in writing and updating these school eye health guidelines that the group put out and are on the website. Priya practiced community and hospital optometry for several years before joining the International Centre for Eye Health at the London School of Hygiene and Tropical Medicine to pursue her interest in public health full-time. She's now assistant professor at the centre and has worked in eye health research in multiple countries across Africa and Asia. And her work has focused primarily on child eye health and school eye health services. Our second speaker today will be Milka Mulfouri. Milka has been a consultant ophthalmic surgeon at the Nhumbi National Hospital since 2001 and is currently associate professor at the Nhumbi University of Health and Allied Sciences, working in training, research and consultancy. She has coordinated the Childhood Blindness Prevention Initiative for 8 years, and together with other eye health stakeholders participated in numerous research pieces on primary eye care for children, focusing on the integration of eye care for children in the primary health system. We're lucky to have her here to explain today around that. And the third speaker on the agenda today is Andreas Muller, Dr. Andreas Muller. He also, I think, will be no stranger to most of you. Andreas is the Deputy Director of the World Health Organization Collaborating Centre for the Prevention of Blindness at CERA, and a consultant to the World Health Organization. And he's worked across various sectors of public health fields, supporting eye research and prevention of blindness initiatives in academia, the non-government sector, and within the UN system. After we hear from our speakers, we will be joined on the panel by Elizabeth Kurian, who is the CEO for the Mission for Vision, and I'll introduce her just before the panel. So what about the webinar today? This webinar aims to discuss actions that we need to take now to accelerate efforts to elevate, integrate, and activate child eye health to meet the growing needs amongst our children. We will hear 3 examples on these themes that have been successful in creating an impact, and then discuss child eye health as a cross-cutting issue, the changing and increasing needs of today, and the actions for the decade. I would like to acknowledge and thank Cooper Vision, who have sponsored Focus on Child Eye Health this year and the webinar series today. We have a second webinar this afternoon or later today as well. And we thank you very much for being involved and being able to help us put this program together. So just before we crack on with the presentations and discussions of the day, I'd like to just start with you. So first of all, we just want to again find out who's with us today. So we're going to use the Slido polls that you can see up on the screen. You can just scan the QR code or join at slido.com and put in the room number 3487820. The first question, without using the title of your job, tell us what you do. Succinctly, please, in a couple of words. It's quite a challenging question, really. So without using the title of your job, please tell us what you do. Probably take a minute or two to get the first answers up there. And let's see if we can get anything in. Right. Have some movement there. Okay. Advocacy and partnerships. Okay, so I need to have people log in and do it. So it takes a bit of time. If you're new on, please go to slido.com and put in the room number 3487820. And just type in what it is that you do without using the title of your job. Develop partnerships with funders, help with learning programs, provide accessible services, communications. It's really great to see actually the gamut of the different groups of people that we often speak to here in our webinars, working across the spectrum from advocacy, partnerships, funding, education, service provision, communication, teaching and mentoring students, training future optometrists. Just have a couple more come through. So you can see that we get a wide range of different people in the audience, but also that it's really important that we actually all work together across all these domains to improve the health of our children, the eye health of our children. Research has come in now, rehabilitation services for low vision people in Moldova, and deploy advocacy actions for their inclusion and rights. Program implementation, supporting access to eye health services, providing the eye care services, continuing education, professional development, researcher, and eye health enthusiast. I wonder how many other eye health enthusiasts we have out there. I'm sure many people could count themselves in that box. Optometrist and financial counsellor. Each time I think we're going to sort of, there's still more people writing, so we want everyone to have a chance to say what they're doing. Fundraising, rehab, implementation of programs. Wonderful. Okay, we'll move on to the next question in the poll. Really welcome everybody, and it's really great to have everyone across the spectrum of what the IAPB community really does do. The second question is on topic. What are the issues in child eye health that need urgent attention and intervention in the setting that you work? I'm sure that you probably, some of you have a list of these at hand off the top of your head, and others may need to think a little bit longer. But what are the issues in child eye health that need urgent attention and intervention in the setting that you work? Again, just a few words in the interest of the poll. Just takes a minute or two. There's a little delay before we see them for when people are answering them. And I think this is the kind of question that really informs what we're talking about today, the work that we're doing going forward, and collectively what we can look at actually addressing together. Oh, we've got one up. Now this is going to come up in a word cloud this time. So visual rehabilitation has come up as the first one. Awareness on eye health. Uncorrected refractive error. Awareness, refractive errors. So we've got the need for parents to have awareness, I think, retinopathy of prematurity screening, early access to services, lack of screening and myopia management, spectacle compliance, which is always an interesting and challenging one, and often overlooked, behaviour change, low vision devices and provision. Awareness still comes up as the most popular one there, and the spectacle compliance, which is really interesting to see as such a more popular option. Treatment of retinoblastoma, awareness and preparedness, herbal medicine funding is always a big one. Just give another minute. Comprehensive programs, lack of HR, human resources in eye health, provision for ref correction, I assume that's refractive error correction. Okay, so you can see that on your screens in the word cloud, and if the last few people want to put some things in, you can still, because we're going to go off the polls, but we're going to capture that word cloud and we can share it again later. So it was really interesting in the polls, first of all, to see where people are working, and that, really we have people approaching child eye health from many different angles on board, which is great, and we can work together to harness those strengths, and lots of those common barriers I think are common or challenges across the people who are on board. So today we're looking at child eye health in the frame of the 2030 Insight Strategy, which builds on so much of the great work already done, but recognises that we'll have to work differently to make sure eye health is recognised and prioritised in the broader health, economic, social and development agenda. So how do we plan, advocate and action this for child eye health? As of 2021, globally, close to a quarter of the world's population were under 15 years old. And we know that over 90 million children and adolescents currently live with vision loss. And it's estimated that 40% of children that are blind from eye conditions, 40% of children that are blind are from eye conditions that could be managed if the child had access to eye care services or could have been prevented. In school-based surveys, we're seeing that uncorrected refractive error is a leading cause of vision impairment, with a prevalence range between 63 to 92%. That seems extraordinarily high. Cataract is now the principal cause of avoidable blindness in low-income countries. There has been a substantial shift in the leading cause of blindness in children due to the reduction of corneal blindness and reduction of vitamin A deficiency and measles. It's estimated as well that half the world's population will have myopia by 2050. During the pandemic, we've seen a rise in the progression of myopia. Myopia progression among older school children in some studies was seen to rise as much as 1.5 times since the quarantine. And one study in China showed the prevalence has tripled in younger children aged 6 years old. So I would like to move to introducing our first presentation for this, well, for me it's this afternoon, for today, and it's on the theme of Elevate. So good vision and eye health help unlock better educational outcomes. Yet eye health is often not addressed in school health and education policies, plans and practice. Sustainable Development Goal number 4, quality education, cannot be achieved if child eye health is not included. Child eye health needs political prioritisation in resolutions, development plans, national policies and budgets related to achieving quality education. School eye health policies, plans and practice have been shown to be cost-effective in multiple settings. So on that note, let us hear from Priya, our chair of our IAPB School Eye Health Work Group and one of the key authors of the School Eye Health Group working guidelines, sorry, the School Eye Health guidelines from the School Eye Health Work Group. So over to you, Priya.
Thank you to IAPB for the opportunity today to talk about child eye health and its importance from the perspective of the Elevate theme in the sector strategy. From a child eye health perspective, the Elevate theme focuses on embedding child eye health into development plans, national strategies, policies and budgets. You may have heard me speak about school eye health programs and frequently refer to the statistics on the number of children that have a vision impairment. Globally, school eye health programs are common and implemented in many different ways, and they also have the potential to change the lives of millions of children. Over 90 million children worldwide have an eyesight problem ranging from mild vision impairment to blindness, and the problem is only getting worse. And if we just think about the sheer number of children, over 25% of the global population consists of children, and 40% of the population of Africa is under 14. Therefore, school eye health programs are important, and they're much needed to help identify children with eye health conditions in a timely manner. However, these programs must be comprehensive, sustainable, and focus on the eye health needs of children. We often advocate for school eye health and we talk about the large numbers, and it's quite easy to get lost in them. So I want to share my experience of meeting Mariam. I met Mariam when she was 13 years old, and I remember her very clearly because she could barely see a few meters ahead of her, and as expected, she was severely myopic. I'm never going to forget the expression that she had as she looked through the trial frames, the smile and the mixture of pure joy and shock. And she picked some pink frames that she was excited to take home. Part of the work I was doing was addressing the stigma that surrounds glasses wear, especially for girls. And so I remember returning to Mariam's school about 3 months later, where we were investigating compliance. And I was really looking forward to seeing her and finding out whether she was happy and wearing her pink glasses. At the end of the day, we looked at the list of children that were absent, and I recognised Mariam's name. So I asked the teacher about her. She ran back to the classroom and returned with a dusty glasses case labelled Mariam. She handed me the case and said that Mariam wasn't at school. So I explained that fine, we're not here to take back the glasses. But she shook her head and said, no, Mariam is no longer at school. Mariam hadn't been at school for the past 2-3 months. In fact, she had probably just used her new pink glasses for a week or two before she was removed from school, as it was time to get married. The Lancet Commission on Global Eye Health included an in-depth look at the relationship between eye health and the SDGs. And there's enough compelling evidence to prove that improving access to eye health services for children will contribute to achieving many of the Sustainable Development Goals, including SDG 4. There is evidence that providing children with glasses improved their academic test scores. Results from a randomized control trial in China show that providing vision correction reduced the odds of failing a class by 44%. In other studies, glasses were improved reading and word identification and attendance at school. But it's not just about this direct link between education and child eye health that's important. Child eye health impacts the other SDGs too. SDG 3, good health and well-being, are also affected. When a child has poor vision, their ability to socialise, interact with their peers, and their general confidence is also impacted. Gender equality is also important to address when it comes to planning child eye health services. When girls are not at school or are forced into early marriage, they are already disadvantaged. Like Mariam, they will not be able to achieve their maximum potential. While there has been progress over the last decades, more girls are going to school, fewer girls are forced into early marriage. There are still girls like Mariam who, despite all our efforts, are not accessing the services they need, and the challenges remain. We all agree that school eye health programs are important, but how do we improve these? How do we address the challenges that we're now faced with? While I don't have the answer, but any solution to a problem this big in terms of numbers and complexity requires a solution that's innovative, relevant, and most importantly, appropriate. School eye health programs need to collaborate and engage with the health and education sector. And while this is already happening in some programs and regions, where school eye health are a part of nutrition or vaccination programs, this isn't happening consistently. Collaboration and inclusion of government, health, education, and even finance sectors, non-governmental organisations, civil society, researchers, innovators, and private sector is the key for the future of school eye health. There has been a number of collaborative efforts that have made great strides in this, such as the previous Our Children's Vision campaign, the Orbis Reach programme, Eye Alliance, etc. But the challenge now is, how do we engage as a sector in unison to make sure that all our efforts together are having an impact? Sometimes when we are in our own settings and doing our roles, all these discussions and ideas seem very abstract, and you don't know where to start or what to contribute. So I'm going to share a quick example of an opportunity that was created a few weeks ago when IAPB hosted an event ahead of the Commonwealth Heads of Government meeting that happened in Rwanda last week. A few of us started talking to each other about the status of school eye health screening in the UK, something that's not standardised or in fact available throughout the UK. And it just so happened that one of the persons in this conversation was a crossbench peer at the House of Lords. This conversation progressed outside of the event, and last week an amendment was tabled at the House of Commons by her. Now, while this doesn't mean a change will happen tomorrow, it does mean that we've been able to raise a question about annual screening for school children in the UK. And this has taken a very long time. But this only happened because we took advantage of an opportunity that presented and had a very clear ask. This slide speaks for itself. There is an interest in school nutrition, in eye health, in vision, in the well-being and welfare of children by sports personalities, celebrities, corporates. And I think we need to be more open and engage with different sectors. In the interest of time, I'm not going to go into the details of each campaign, but on this slide are Marcus Rashford, an English footballer, Virat Kohli, an ex-Indian cricket captain, Amitabh Bachchan, a very famous Bollywood actor, and Disney's new heroine, Encanto. While I'm not suggesting that we start spending our budgets on celebrity campaigns, what we do need to do is become more innovative with the opportunities that do become available to us. And I'd also like to encourage everyone to participate in advocacy campaigns that are led by IAPB. They continue to do incredible work to drive eye health up the global agenda, but it is an uphill battle. So I never saw Mariam again, but years on I still do think of her, and I have her pink glasses to remind me of why we still have a long way to go to ensure that school eye health programs are of a good quality and that they're no longer standalone and one-off initiatives. They have to be sustainable programs that are embedded within school health and education and social services, and they have to be programs that are comprehensive. Thank you.
Thank you, Priya. It was really great to see you break down some of what you said is lofty words, and sometimes we don't know where to start, into really specific examples of how we can elevate eye health. I was really interested to see that the opportunity you said about changing the law making an amendment in the UK House of Commons, which is, you know, a wonderful opportunity to put some standards around vision screening. And it reminds me of my own experience here in Australia, where that was not standardised previously, and you could see children that I knew slipping through the system, and we know that happens all over the world. And, you know, just to keep connected to services on the ground with that pink pair of glasses that you have to remind you of why we need to do what we're doing. The second presentation we have for today is around the theme of integrate. As a sector, we will need to come together to work differently. Integrated people-centred eye care looks at reorienting the model of care, coordinating services within and across sectors, and creating an enabling environment. We need a holistic, integrated approach where eye care is treated as an essential element within wider healthcare services and is universally available to everyone. We also need to ensure there is integration within and between the different eye care professions. So on this topic, I would like to welcome Milka to talk to us today. Thank you.
So thank you very much. So today we are talking about the integration of primary eye care for children into the general child health system. Why do we integrate? Why is it important? We know that many diseases, for example, measles, that cause child mortality and morbidity, are also the causes of visual impairment and blindness, but they are also preventable at the community or the primary level. So it is important to integrate in order to share resources, including human resources. For example, one nurse may be performing general eye care at the same time performing eye care. Also share the infrastructure for the promotion talks and materials, but also we can share funds in order to reduce the implementation costs. And lastly, to provide comprehensive health promotion messages that are important for eye care, because eye care is part of the general health talks. Now, what do we mean by integration? We mean that eye care for children is being implemented within the general child health system in order to ensure that every child who presents to the child health services is screened for eye problems. Now, we need to include in the routine general care of the child, we need to include newborn eye screening, and also that all children who cannot see, or those who have a white pupil, or those who have serious eye injury need to be referred to the eye worker as immediately as possible. But other things is also to practice cleaning eyes at birth and application of antibiotic, not to use traditional eye medication, but also to include eye health education messages in the health talks that are given at the clinic. Now, how can we integrate? We can integrate by training primary healthcare workers in child eye health so that they are able to screen and refer appropriately. We can also integrate by increasing awareness in the whole child health team about child eye conditions, for example, obstetricians, pediatricians, physiotherapists, midwives, and others. We can also integrate by working in the community with teachers, community health workers, parents, caretakers, and even drug distributors. We can also integrate by sharing data for monitoring. Now, how did we manage to integrate child eye care in Tanzania? Now, firstly, we had an evaluation of a pilot study where we trained primary health workers in the 10 keyword health organization activities for health eyes. And we found that there was inadequate knowledge and skills among primary health workers. But that improvement, there was also improvement after the training, improvement in the knowledge and skills after the training, which was retained to about 1 year. We then conducted a formative research in rural Tanzania and created a theory of change. In that study, we also found baseline situational analysis of mothers and caretakers' knowledge of eye conditions and behavior towards anybody who is sick with eye conditions. We also reviewed the clinics in terms of the number of children seen, the available consumables and equipment. And also we looked at the primary health workers' knowledge and practices regarding child eye health. Now, further, we continued other steps by asking ourselves, how can we integrate child health into the general health system? Which fora can we use? And then we thought about the IMNCI. The Integrated Management of Childhood Illnesses is a program which is implemented globally in more than 100 countries. And the aim is to reduce mortality rate among under fives. And so it is a program which is well implemented in Tanzania by primary health workers, mainly at primary health facilities. So in Tanzania, training of primary health workers is done as in-service training. And so we thought this was a better forum where we can enter to include child eye health. Now, we conducted a stakeholders meeting where, after explaining our intent and what we wish to do, a consensus was reached by the Ministry Health agreeing to develop a program which could be included in the training of IMCI. So we developed the eye health module, which is called Module 6. Pilot tested it in real life IMCI training. That is, we had to train IMCI the usual way, but including the eye health module. And from there on, the eye health module was included in the training of the national IMCI, and it continues to be trained to date. So what impact has it brought? Until now, on every training of IMCI in the country, the eye care is also included, and we feel this is sustainable as it will continue being trained all the time. Until now, 3,000 primary health workers have been trained from 2018 onwards. And our plan for the next phase is to have evaluation of the national program where IMCI is being trained, including the health module, and this will be in collaboration with the London School of Hygiene and Tropical Medicine. We hope that apart from evaluation, scaling up of the program is possible. We are very thankful to the people who worked with us, including London School of Hygiene, MUHAS, the Ministry of Health, and all these people that were very instrumental, not forgetting Professor Claire Gilbert, who worked tirelessly in this project. Thank you so much for listening.
Thank you, Milka. What a fantastic example and demonstration of practice in Tanzania, and one of the general health units that have now included eye health module, and look forward to hearing more about the scaling up of the program and also the sustainability as you continue to evaluate it, and the replicability in other settings. It looks like an amazing initiative. Congratulations to all involved. Just before I introduce the next speaker, just wanted to make sure people remember that you can ask questions to any of these speakers in the chat box, in the Q&A box, and we will answer those questions during the panel, which we'll have after the third speaker. So we now have our third speaker, Andreas Muller. This is on the theme of Activate. Empowering people to demand eye care services by making them more aware of what they can do to look after their own eyes is essential in ensuring access to quality eye care services. This starts from childhood, where individuals have all the information they need to protect their own eyes and, crucially, take the steps they need to look after their vision and eye health, from taking regular breaks from close work through to seeking help for any ailments or discomfort they experience. This level of awareness and demand should continue through people's education pathway and employment environments. The World Health Organization has recently developed Myopia Ed as a public awareness campaign to change parents' and children's behaviours to be able to delay the onset or slow the progression of myopia. Andreas will now present to us on this program and the impact that is envisaged to influence individual action. Over to you, Andreas.
My name is Dr. Andreas Muller. I work with the WHO Vision and Eye Care Program at headquarters, and I would like to thank IAPB for inviting me to this important webinar on focus on child eye health. I was asked to present on a new WHO tool named the Myopia Ad. And I will start off with some background information. Most of you will be familiar with those. So as you're all aware, myopia represents an important public health challenge globally, with well over 2 billion people being impacted. Importantly, and although the correction with spectacles is highly cost-effective, uncorrected myopia is a leading cause of vision impairment in children and adults. We do know this problem is escalating, and the numbers are expected to be well over 3 billion people by the year 2030. In recognition of this challenge, and for the first time, WHO member states recently endorsed an ambitious new global target for refractive error at the 74th World Health Assembly in 2021, namely a 40% increase in effective coverage of refractive error by the year 2030. This is a very ambitious target, and WHO recognizes that a comprehensive approach is required in order to achieve this target. With this in mind, WHO and the International Telecommunications Union, or ITU, have developed the Myopia Ad Toolkit, recognizing that improving public education is critical in the management of refractive error and to drive the demand for spectacles, particularly in lower income settings. The toolkit, the Myopia Ad Toolkit in itself, has two key components. First, there's the evidence-based message library to be delivered to individuals in the population. Second is a handbook or toolkit which contains background information, but more importantly contains guidance and resources required to support any country or stakeholders in a step-by-step fashion through the planning, the developing, the implementation, but also monitoring of a digital health message initiative targeting myopia education. So now let's look at some of the aims and objectives of the Myopia Ad program. The first objective is really to support behavior change that contributes to delaying the onset and also possibly slowing the progression of myopia. This is particularly important considering that we see complications from high myopia are now an emerging cause of irreversible blindness in some regions of the world. The second objective is to improve awareness and health literacy of the importance of regular eye examinations and to comply with spectacle wear amongst people with myopia. This is important because we know that even when children or adolescents do have access to spectacles, quite often they don't wear these specs when they should due to a range of misconceptions, but also stigma at times. Who is the target population for Myopia Ad? The program targets 4 distinct segments of the population, and separate message libraries have been developed for each of them. First, the general population involved in the care of children. Second, parents or caregivers of children with myopia. Third, the adolescents with myopia and also adults with myopia. What are the key themes of the program? The general themes of the messages in the Myopia Ad program cover education, such what are the causes, what are the warning signs, and addressing some of those misconceptions that we heard before. Then Themes targeting those lifestyle behavior changes that we implicated, in particular delaying the onset of myopia. This includes in particular promoting increased time spent outdoors amongst children and also reduced intensive near work activity, such as the use of devices, particularly during leisure times. Thirdly, a key theme is the importance of regular comprehensive eye examinations in children. This is very important, especially considering children's eyes and prescriptions are constantly changing. Last, the program promotes compliance, meaning the fact that spectacles are safe and they should be worn regularly. Now, how is the program and its messages designed to be communicated? Firstly, the program design is a recommendation, and any country or any implementer of Myopia Ad can adapt this in line with the resources they have available and also the local context. At the moment, the structured messages have been designed mainly for one-way SMS delivery. This can be used in other messaging modalities, for instance, WhatsApp or WeChat, and also social media. The message libraries also contain some multimedia suggestions that can accompany the messages where this is also possible. The duration of the program is such that individuals who sign up for the program would receive messages over a 6 or 12 months period. Now, this period is in line with evidence that this is the amount of time that is typically needed for a behavior change to be incorporated in a person's life. In the acute phase of the program, the individuals will receive messages at a higher frequency, and this decreases over time so not to overburden the user. The messages are categorized into one of 4 domains: motivation, support, information, or reminders. Here I provided a few selected example messages in each of these domains to give you a taste of the actual messages. So, for instance, did you know if a parent has myopia, their children are more likely to develop it too? Regular eye tests will be important to detect myopia early. Or research shows spending more time outdoors lowers the risk of myopia. Encourage your child to go outside and play. Or worried about your child developing myopia? Remember, eye health professionals are here to help and support you. Or remember to wear your glasses every day at school. This will help you see things clearly in your classroom. Who are the intended key end users of the Myopia Ad Toolkit? The Myopia Ad Toolkit targets government officials, academics, and other in-country implementing partners who are involved in deploying large-scale digital health intervention programs. However, the Myopia Ad Toolkit and messages are available for anyone or for any individual or group to use in their efforts to promote, to improve or promote population education on myopia generally. Lastly, I want to touch on what the eye care sector can do to support Myopia Ad. First, I see that there's the opportunity for technical support. Partners might provide translations, might carry out adaptations or revisions of the messages based on cultural realities in their countries, or they might carry out evaluations on the impact of the program in a country. Where necessary, partners might provide funding where countries lack the required resources for a myopia prevention campaign, or, and very importantly, partners might raise awareness about myopia as a public health problem and about the existence of the Myopia Ad Toolkit to be implemented. With this, I'd like to end my presentation, and I wish you all a successful webinar.
Good, and it's great to be able to see the each time I see the Myopia Ad presented, I learn more about it, and can really relate to the way that we can use it. It's quite amazing to see a specific eye health initiative as part of the WHO Digital Health Initiative, Be Healthy and Be Mobile. And I think it's worth noting for the audience as well, there's other modules that are around eye conditions that are very relevant to eye health as well. Sorry, around general conditions that are relevant to eye health as well. It's a really good tool for understanding and setting out who is the audience, what is the target behaviour we want to change, what is the behaviour change principles behind it, and then the different domains of providing information, support, reminders, and action. And it was really interesting to see point out one of the key barriers that people, or challenges people noted at the beginning in the polls around addressing compliance and stigma as a key strategy in that toolkit. So hopefully that is useful for people listening. They're just to summarise, all three of our speakers, I'd like to thank you again. It's really, really informative and interesting. And all three had actions that are appropriate for our sector-wide to work together in child eye health, with Priya encouraging everyone to participate and support advocacy and policy dialogues led by IAPB members and sector across the board, utilising the different mechanisms through WHO and UN that have provided resources, support, and be part of campaigns, and be able to catalyse opportunities from these to be able to improve child eye health. In Integrate, Milka also really demonstrated how it's good to share best practice and evidence, and be able to use this to scale initiatives together nationally, and potentially even be able to replicate going forward in a module that is in lots of countries around the world. And Andreas just outlined the particular asks, aside from obviously using the toolkit, is around the technical expertise and the funding and creating awareness that the toolkit exists and helping support the implementation of it. So again, I'd like to thank you all. Just before we go into the panel discussion, we just will have one poll now that you're thinking about the different areas of eye health. What are the changes that you would like to see actioned for child eye health by 2030? So again, go to slido.com and to the same room, and this is a free text, open text poll, and we'd like you to just describe the changes in a couple of words that you would like to see actioned for child eye health by 2030. So we'll just give that a minute. It takes there's a little bit of a lag between you entering it and us seeing it on screen. So just give that a moment. Looks like we have some answers coming through. Good to see that some people are writing questions into the Q&A. Please continue to do so as well after you put your answer on the poll, and we will ask that through they will ask as many of those questions as we can during the panel discussion. Okay, so changes. We'd like to see increased myopia management, uptake of spectacle compliance, more free and affordable access to eye health, programs showing the results, I guess evidence that they're working, sustainable and effective collaboration and linkages, addressing uncorrected refractive errors, compulsory eye examinations in schools, awareness, funding commitment to screening programs, standardized timelines for screening, compliance for treatment, better and continuous collaboration between education and eye healthcare team, compliance post-care and treatment. So lots of very important themes coming up here, a wide spectrum. Okay, so just let one or two more responses come through because I can see people typing, and then we'll move into the panel. Just while the last few people are typing, I will just introduce Elizabeth Curian, who's also going to join us for the panel. We have Priya and Andreas and Elizabeth. Elizabeth is the CEO for Mission for Vision. She comes to us with over 27 years of experiences in the corporate and development sectors across different organisations, having worked for the University of Baroda, Nielsen India, and Sightsavers. She's led strategic planning in large programs with complex, diverse organisational and operating environments, and pioneered and fostered significant growth and transformation through social policy change and innovations. So we can see there's some more changes on similar themes that we have had already around more outdoor activities for children, collaboration amongst eye care professionals, compliance and awareness. Thank you for putting in all your priorities there. So I'm now going to welcome Elizabeth, Priya and Andreas to the panel to join me on screen. So thank you everyone for joining us, and particularly thank you Priya and Andreas for the presentations. We're just going to start the panel with one question to each of you in similar theme to our polls. So we know the challenge, we know the need, we know the importance, and we know the urgency with which we should address child eye health. If you could say one or two things that we should be doing differently, what do you think it is that we should be doing differently? And I might start with Elizabeth today. Elizabeth, can you put your microphone on, please?
Sure. Thank you, Jude, Priya, Andreas. In terms of prioritization, where do we begin? There are so many priorities. But, as somebody working in the sector, I think one thing we seriously lack is really high impact evidence with regard to effective and efficient school or child eye health programs. We really need very good evidence that shows the efficacy of these programs and the impact it can have long term. Impact as well as integration, the demystification of the technology that's available these days. It's not that complicated, especially at the primary level. So that's the second point, the demystification of possibilities at the primary level. And third, and very important, budgets. If you have the right budgets, you can influence policy through appropriate practice. It's very important. So these are the three priorities, I would say, in terms of doing things differently.
Yeah, well, three huge areas right up front. I'm just going to open that for Priya and Andreas to add their discuss or add their perspectives to it.
Yes, I mean, exactly what Elizabeth said, but also I think we often just speak to each other and we all know what the problem is. I think we do need to start speaking to others outside of our sector to make them realize what the problem is and speak in a language that is understood by them rather than what some of us are used to, academic language.
That's a great point, obviously. And Andreas?
Yeah, thank you. A lot of the discussion and the comments in the chat are about uncorrected refractive error, and I think that's rightly so, considering that by far uncorrected refractive error is still the #1 cause of avoidable visual impairment around the world. And of course, if a child has uncorrected refractive error and that's not being managed, that will have very likely impact on the education of their child, etc. So at the same time, we have a reality that countries or health systems or governments don't necessarily see the provision of optical services their responsibility. And I think that is a key barrier, that the fact that so many of the programs that were mentioned rely on NGO support, they might be short-termed, they're not sustainable. At the same time, we have a solution that is highly cost-effective. Providing spectacles is not expensive, and it makes a huge difference to a child's ability to learn and its quality of life. So to me, really, the #1 priority is to communicate to your governments, to your planners for health, the fact that we now have a global target around refractive errors, the fact that WHO treats refractive error as a health condition. Glasses are not a luxury item, they are a medical device. And to have this very necessary discussion on how can we make sure that refractive and optical services are provided within a government health system and not entirely relate or rely on private sector or NGO support. I think that for me is a key message.
Yeah, wow, there's a real breadth of different things that we need to address between what everybody has said, but they do definitely kind of link in to each other. We have a number of questions coming through. So I'm just going to pick up firstly on something that Elizabeth said, and I know Priya and Andreas that you both have a lot of experience in this area of evidence. We've made huge progress with from the World Report on Vision and the Lancet Global Commission for Global Eye Health. But we know that we are missing large pieces of research and evidence to support the case for child eye health. What are we lacking, and what evidence can we as a sector, what do we need to bring to the table to elevate our case? Priya, do you want to go first on that one?
Yeah, sure. I think one of the things that governments care about, and if we want governments to adopt child eye health and school eye health as national policies, is the evidence on the economic returns. And that's something I feel, we look at the impact on education, but it's kind of extrapolating that and turning that into what's the money involved. And that's what governments care about. What resources do they need to put in, and what's going to be their return on investment on things like school eye health programs, and providing these glasses and refractive services from national services rather than public, from private or NGOs.
Andreas, Elizabeth, would you agree? Add to that? Let's see, Andreas.
Yes. Yeah, sure. I fully agree with what Priya just said. And Priya, I remember reading one of your papers which looked at the compliance, right? Compliance of kids wearing glasses, even if they were provided glasses at no cost. It's really disappointing. The Lancet Commission says that spectacles is one of the most effective health interventions for children in helping reducing the chance of failing by at least 44%. In many of the low-income countries, children have access to glasses at no cost. This could be from the government, NGO, or private sector. But why aren't children wearing glasses? That's really important. So sometimes it makes me wonder as to, what's the impact of all of this? And increasingly, we see in some of the countries that we work in, the low-income countries, there is a lot of investment from the private sector in eye health, especially for children. A significant investment, and that keeps increasing by the year. So endorsement from the private sector would really help us, I think, because we know the private sector has different metrics in terms of their strategies, in terms of measuring impacts, etc. And their voice, their views, their endorsement and advocacy will really make a difference. Just investment won't do. They really need to endorse the impact of school eye health or child eye health interventions and the difference it makes to kids and on society. And the third point is, mindsets. Many of us have hesitation in learning from other environments. What works in Africa can work in India and vice versa, or other parts of Asia. So we really need to be open-minded and learn from different cultures and contexts.
Andreas, is there anything you'd like to add to that?
No, I don't have any particular issue to add, but I think that these are all very valid and very important points. Fully agree.
I think there's sort of new areas for us in child eye health to work collectively together. While we've dabbled a little with private sector and the metrics around that, and also with return on investment, it's something collectively that we can bring together and use more, maybe more strategically, more powerfully in a collective way. So we're just going to look at a question that has come in around Priya's topic around Elevate. So I've got two questions here. So number one, pretty directly from your presentation, in countries like Ghana, where resources for eye health is limited and it may be difficult to provide free spectacles and free services for those with other conditions, how effective will school screening programs be, even if eye care professionals take it up in their time in their communities? Is it really worth it?
Thanks, Jude. So, I mean, I sympathise and I completely understand that where that question is coming from, having worked in these settings. I think my response to that is that if it's not the services you can provide yet, then obviously you can't start the screening, and that's going to be the first principle. But then you've got to start somewhere. And if it's a case of we're going to start by just having awareness campaigns of why these services should be provided, then we'll find that there's some buy-in, and it's about speaking to the right people. So it is worth the time, but yes, absolutely, don't start a service if there is screening if there is no service, but maybe start with awareness campaigns, maybe start with discussions with the right people about why these services should be there.
And that actually leads quite nicely into, I'll let the others comment on both together, that leads into the next question that we have is, whom should we be influencing and including so that child eye health gets the attention it deserves on a national level in policies, budgets and systems?
Should I guess Andreas or Elizabeth, or I can start. I mean, the obvious one is the education sector. You know, if they are able to advocate for why children who are at school already, and remember, having school eye health programs is actually quite a low-hanging fruit in some places, because you've got a mass population in one place at one time who come regularly to the same location and see the same people. So we should be using that opportunity to start with the education sector, and that's the obvious one. There are obviously multiple other people to engage with, but I'm just going to state the obvious here. We should start with the education sector and start thinking about child eye health as not just a health issue, but an issue that is then impacting the child in all other aspects of their lives as well.
Andreas, Elizabeth, would you like to add to that? Who else should we be influencing?
I think, Andreas, were you about to say something? Okay. I think for me, the most important group are the parents and the caregivers. If the parents are convinced, you know, they can do, I mean, they go the extra mile or hundreds of miles for their kids, right? I've seen parents with limited means spending $50 to $100 on a phone, on a mobile phone. You know, it's so popular. Or spending money on sunglasses. But when their kids' spectacles break, they just can't be bothered. I wouldn't say, no, that's too harsh. I wouldn't say that they can't be bothered. Of course, they're bothered. It's just that they don't realize the importance. A pair of spectacles that are given free of charge. And if you have to buy another pair, it looks, you know, in some settings, it costs just $3 for a very good pair of spectacles that a child can use. And in some environments, it's given at no cost again after 1 or 2 years. And that's a mystery, you know, that just eludes me. I wonder why parents don't invest in that. And they see the difference it can make to a child's learning and other developmental initiatives. So for me, the parents are the most important group. If you can convince the parents, I think anything is possible in today's world.
Yeah, they are a very powerful group in individual action, but also in a lobby group if we want to influence education sector or others. Andreas, do you want to add anything?
Yeah, I think I fully agree. The education sector could be a very strong partner in raising awareness, but also initiate sustainable, at least vision screening and look at referral systems that actually work without the need of multiple referrals that are required until the child actually receives a pair of glasses. At the same time, I think we underestimate the misconceptions in so many parts of the world by parents about the safety of glasses, misconceptions assuming that glasses might weaken your eyes if you wear them over long periods of time, etc. So you can have the most beautiful, policy campaign to reduce cost and increase awareness. If the trust in the population is not there, then all this is for nothing. So really, unfortunately, behavioral change is never an easy task, as we've seen with quit smoking campaigns, which took 30 or 40 years to change behaviors in a meaningful way. So really, how can we reach parents and the children themselves to change behavior is a key question also for the research issue that was discussed earlier. What are meaningful ways to reach out, and I'm sure they differ in different parts of the world. So localized research about successful behavioral change, I think, is very important.
Yeah, I think that's really interesting and huge point. And like with most of what we're doing, the behavioural change, there are a lot of experts around the world in behavioural change, and so working together with them to study the particular aspects of eye care that for child eye health is probably also a group to be influencing and including, not just sitting out on our own in a silo on that. So the next question that I have is around the integrate theme. More children will stop losing their sight and benefit from better eye health if eye care is well resourced and properly integrated into mainstream health systems. Oh, sorry, I'm reading the wrong question. Sorry, I'm going to just go back one question. There is a clear-cut call to changing the ways we work. This means more trained people on the ground at multiple levels who can provide the continuum of child eye health services that are demanded and needed. What can we do? How can we achieve this shift in the delivery of services and the numbers? And what are the risks if we do not change? Andreas, I might go to you first on this one, if that's all right.
Yeah, I might use that question to promote some very recently launched WHO tools that might help with that thinking in terms of what can we actually do, how do we get started. You might be aware that I think it's now 2 weeks ago, WHO launched the Guide for Action, Eye Care in Health Systems, which is basically a step-by-step manual of recommended approaches to the planning and the implementation and the monitoring of integrated people-centered eye care. I think many of us were sort of, when they heard that term for the first time, they say, okay, well, what does that mean? What's supposed to be different from the way we've worked for the last 10 or 20 years? What should we do differently? So this Guide for Action is designed as I said, a quite straightforward step-by-step guide over sort of 4 to 5 year planning needs, and also links to 4 new specific tools provided by WHO around human resources planning, around planning of service delivery in the package of eye care interventions, around monitoring eye care services. So there's a particular tool that recommends specific indicators that countries may or should monitor over time. That's the eye care monitoring framework, etc. So I really encourage you to go to the WHO Eye Care and Vision Impairment website, where you can find and download the Guide for Action. It's being translated in all the UN languages at the moment. It's only available in English, I'm afraid, but that might be a helpful set of resources that also each one of those tools referring to uncorrected refractive error and to child health in particular. So yeah, back to you, Jim.
Yep, thanks, Andreas. And there was a specific piece around how do we shift the delivery of services and the numbers. So Priya or Elizabeth, do you want to add sort of a little bit more of an on-the-ground perspective, I guess, around that as well?
Yeah, I can quickly start, and I can share a quick example actually from one of our programs that we've been working in Pakistan, where refractive services were only provided at a tertiary level for the area that we were working in, but we were able to gather the evidence from the program to say, actually, if refractive services were provided at at what they call the basic health unit, closer to where people were in the communities, then it would save the travel time for people going to the temple. But unfortunately, these health units didn't have an optometrist or the equipment that was required. But evidence from the program showed, the number of people that were traveling so far, but also not just that, the number of people that chose not to travel because it was so far to get basic refractive services. And so evidence like that helped for us to present it to sort of provincial level. And we have now found that a number of the basic health units are equipped with optometry equipment, but also an optometrist, while who's not there all the time, is now available to come back on specific days. So I think it is possible. It's just finding what the actual issue is. Is it the travel distance? Is it that equipment's not available? Is it that there are no skills available? Because often, we often hide behind the excuse, oh, it's just not available, and don't investigate further. What is it that needs to be done to change that? So I suggest, when there are issues like that, really finding out what is the core problem and then addressing that with the evidence.
Yeah. And that's a really good add-on, and I think it works well with the tools that Andreas was talking about, because if you know what the actual problem is you're trying to address, or the barriers, then you can look at the tools that are being suggested as well and be able to use them together. And Elizabeth, I'll give you the final point on that one. We have to move to the next question.
Yeah, sure. I've come across evidence that says that 40% of children who are blind or visually impaired shouldn't be blind or visually impaired if they had the right access to care, especially at the primary level. And today's world, technology is really making giant strides as far as eye health care is concerned, and that includes children as well. There is technology available that can be used by the allied ophthalmic personnel category. You don't need doctors as well. Even optometrists can guide the whole process. So you can really simplify technology and optimize human resources, and that also enhances acceptance, appropriateness, and sustainability. At the same time, we all talk about the primary level, and we sometimes tend to overload or expect too much from general health workers, primary health workers. I fully appreciate the value of this cadre, but in many contexts, they're overloaded with so many other things. For example, maternal and child health care, water sanitation activities. So our expectation from this group should be very realistic. We can't expect too much. So the integration is both within the sector, increasing attention to child eye health other than cataract, which has, preoccupied most of us most of the time. So integrating child eye health within the sectoral priorities is important. At the same time, when we look at things at the primary level, realistic expectations from general primary health workers.
I think that is very, very helpful. And again, I think it points to some of the work, the WHO is coordinating around making sure that eye care is in a core part of primary healthcare services, and with time, hopefully resourcing that properly. Governments looking at that as they're doing resourcing their primary healthcare workers. I've got time for one more question. We have a couple of questions on the Myopia Ed product for Andreas. So Andreas, the question has been asked, has Myopia Ed been deployed in any population so far? It's got a couple of points. I'll just read it all and you can think about it. Has it been deployed in any population so far? If so, what is the impact? How do NGOs link up to use it? And is there a cost involved to use it?
So the tool has been launched very recently. In order to prepare a campaign, this is not a very quick activity. It takes time to, like I mentioned in my presentation, to perhaps adjust the messages, perhaps translate the messages, to identify the right digital partner in the country to work with over the period of 12 months. So right now, I'm not aware that a country has started a campaign. In China, for instance, where, obviously this is a very important public health issue, we are currently doing research work around the modifying of the languages. We've just translated the message library. and we're looking at partners through government on implementing the campaign in the country. So that's probably the place where we're making the most progress so far. But like I said, this is something that takes time and good preparation, because otherwise you're very quickly wasting a lot of resources on something that's not prepared well. And the relevant partnerships are obviously crucial. In terms of funding, so at WHO we are looking at trying to raise funds for countries to access that don't have the means to resource a campaign such as this. This is sort of work in the making. At the moment, we are aware that some NGOs are in discussion and planning, but really it will depend on the individual countries on whether this is something that can be funded through existing health promotion budgets, or whether it requires external NGO funding, local or international. So it really depends on the country. But what was the other question? Who funded it? Yeah, like I said, we haven't got a specific campaign to use as an example quite yet.
So I guess
NGO, yeah. So the
NGO, how do they link up that specific part of it?
How do they link up
to use it? So NGOs would advocate to governments to implement it. Is that the primary role, or is there other roles in there?
Yeah, so I mean, we through our channels at WHO, we're promoting this tool to ministries of health as much as we can. But as we all know, eye care is a very specialized area that usually lacks the sort of voices and the advocacy that you see in larger program areas. So we really rely on NGO partners to push, something like this particular tool, communicate to prevention of blindness committees or Vision 2020 committees, whatever is available, to say that this is something we think is relevant and perhaps important, and then through that channel raise the awareness in government about the potential of such a campaign. So please, I encourage you to get in touch with WHO, and you'll find the contact emails on our website after perhaps looking at the tool, and then discuss with us directly about how to go ahead and building a network of partners in your country and preparing a potential campaign.
Fabulous. Thank you. I think that for anyone that can't find the links, I think that in the focus on child eye health, we have links to the WHO tool and site for that. So we're coming towards the end of the webinar. I think there's been a really, really interesting discussion, and I really enjoy that we've looked at several levels around, looking at the policy and integrating child eye health at that level, looking at integrating it into programs on the ground, and also looking about the aspects of campaigning and empowering people to take care of their own eye health, or their children's eye health in this case may be. So we're starting to make a tradition in IAPB webinars to leave with elevator pitches, and we ask panelists to give us a 1-minute elevator pitch about the most important action we need to take now, so no child is needlessly blind or suffers due to poor vision. So I'll just repeat that again so that you know that and think about it, and then we'll go around. So in 1 minute, could you please put forward the most important action that we need to take now to ensure that no child in the future is needlessly blind or suffering due to poor vision? I'm going to start with you, Priya, in the order that sort of went this morning, or today.
Yep. I'm going to put up 2 calls to action. One is a granular level from a program perspective, and I'd really encourage programs where you are doing school eye health programs to just collect standardized data and actually starting to use that data. And I know obviously uncorrected refractive errors are a hot topic, but also remembering that for child eye health, we do need to think about all the other eye conditions that children are affected with. Some are vision impairing and some are not. Just to be aware of those and start collecting that data so that we can advocate for comprehensive services. And then finally, I know we've had a global commitment now from the Commonwealth countries we do need to use that opportunity. We can't just let it be a commitment. We do need to keep on pushing them, to keep on reminding them that it's a commitment they've made, and to actually then put that into action.
Great. Fantastic. Elizabeth, I'll come to you second.
Sure, Jude. I'll just summarize the thoughts that have come out from this meeting. Of course, child eye health must be a global and national priority. There's no two ways about it. So we should call for governments and partners to prioritize what I call the 5 I's. Importance, that is, accord importance to child eye health, make it a national priority with dedicated leadership and varied partnerships, especially with the private sector. The private sector should talk a little louder about the impact of child eye health. Invest. We need to invest adequately and urgently in activities that give neonates, babies, and children the best start in life through good eye health. Integrate and include promotive, preventive, treatment, and rehabilitation activities within the wider child developmental agenda, with specific importance and emphasis given to developing a diverse and resilient workforce, especially parents, if I include parents among the workforce. Inform through IEC approaches and effective evidence for policy and practice. Innovate, especially when it comes to technology these days. There's so much in terms of possibilities. And I think all of these will go a long way in impacting positively and in transforming child health and lifelong development.
I like the 5 I's. Very cool, especially in our field. And Andreas, you hit the last word in the elevator pitch.
Just briefly, and I might be repeating myself here, but really we are at a very exciting point in time where we have some very important high-level commitments by all member states of WHO, United Nations, towards putting resources and putting efforts into eye care. And we've got for the first time a global target around uncorrected refractive error. So really, I think we should use this momentum in time. We should make sure that we communicate and advocate this commitment at every potential opportunity to ministries of health, to planners, through existing committees in countries, or through your professional associations, whether you're an ophthalmologist or an optometrist, to use your voice to communicate to health planners to ensure that eye care is integrated into wider health systems planning.
Thank you. I mean, what great messages to leave with. And I think, really have all touched on the point of why we have focus on child eye health, to be able to leverage those opportunities that you've talked about, make sure that we work together to really drive a lot of the 5 I's that you talked about, Elizabeth, to make sure that we are leveraging those opportunities, acting together to create action at government, non-government, private sector, whichever level that it is. So yeah, thank you all for your elevator pitches, and encourage everyone to link into the Focus on Child Eye Health website to be able to bring some of those things together. You'll find links there to the WHO tools and materials, as Andreas spoke about, the school eye health guidelines that Priya and the work group have worked on, and a lot of other resources that are there. Just before we head off, we have one last poll for you. We would like to know, what was your biggest takeaway from today's discussion? So we did cover a lot of ground, a lot of useful ground. What was your biggest takeaway from today's discussion? Just wait for that lag until we get a thing. And sorry, I see, Russell, you've taken the speakers off, I guess, because the poll's up. But I do want to thank our wonderful speakers and panelists today, Priya, Milka, Andreas, and Elizabeth, for sharing their insights, their expertise so freely and openly, and giving a lot of great calls to action for us to all be able to take away. If you want to refer back to anything anyone has said, this recording will be available over the coming days. So yeah, just waiting to see what your biggest takeaway from just today's discussion is. Looks like it's starting to come through shortly. Building strong foundations. It's important. Change, I like that. To change the way that we're doing things. Okay, in the interest of time, we'll leave the poll up for a minute, but I'll have to keep talking over it because we're going to run out of time. So today, very much, thank you for joining us. Thank you for giving us your time and discussing with us the concepts of elevating child eye health into the education system through school health programs, integrating child eye health in broader health systems, especially at the primary care level, and empowering parents and children to better understand and advocate for their own eye health. As I said, please have a look at the website. A big thank you again to our panelists and our speakers, as well as to Cooper Vision for making this all possible. Personal thanks to Gissa James and the team that have been working on Focus on Child Eye Health, and in particular this webinar in pulling it together.